We are opening today's session the way that we would any of our REACH sessions, with music. Music is a connector, and it's often very soothing to come to a space where you feel warm, openness, and an ability to engage. This particular song was an intentional choice. It's, of course, the meaning of the song, Someday We'll All Be Free is the name, but it's by Donny Hathaway, an R&B icon who unfortunately committed suicide. So it's also kind of an homage to our need for recovery-oriented support. So now I'll turn it over to Vanessa to tell a little bit more about our REACH activities.
Yes, thank you, Ingrid. Hi, everyone. My name is Vanessa Vronsky, and I'm a program manager with C4 Innovations. All of our REACH sessions include interactive videos and tools designed to promote discussion around the importance of moving diversity, equity, and inclusion to true justice and belonging for all. And I'll pass it on to Janan. Thank you.
Hello, everyone, and welcome. My name is Dr. Janan Wyatt, and I am really thrilled to be with you all today, and most importantly, excited about creating a space virtually that we can learn from each other, especially given the work that we are focusing on. I think it's really important to just make a note that in all of our work and training sessions, it is our priority to curate virtual spaces that are warm and open. And one way to do that is to create spaces by using affirming, respectful, and recovery-oriented language so that everyone feels comfortable contributing to the conversation. And we hope that you also feel comfortable in today's presentation and discussion and really try to adhere to recovery-oriented and affirming language.
Thank you, Janan. So who are we? And I really want to stress that this has been an effort for the entire mental health TTC team, that they are all, some of them are here together. So this is why we are called Better Together. Our area of expertise is recovery-oriented. So let's just go with the team first for a moment. So you will see our Yale team, slow down a little bit. We have with us, I see some of my colleagues here, and you have a new PI, Dr. Janice Sandora. Janice, if you want to wave your hand. We started this effort a few years ago on our C4 team. Next, we have the C4 Innovations. We have Livia, Vanessa, Holly, Cheryl, Christina, and Ashley. And on the other partners are the Harvard University. We have Michelle, Dr. Kashavan, Raquel, Lola. You see everybody here. And we couldn't be luckier. We have the best team in the entire world. So when we decided to come into, next slide, into this work, we all together as a team, and you're gonna hear a lot about the word intentional. This has been an intentional effort because our area of focus as a mental health TTC is recovery-oriented practices. Then we decided, well, we needed to look at our principles. At that time, the PI was Dr. Larry Daverson. The entire team revised the principles, and we make it very intentional that equity, we had, of course, culturally based influence practices, trauma, all of the principles that you can see. But in everything we do, in every tool we do, and in every we terminate the recovery-oriented principles, and we're always concentrating on the equity piece. So why did we start this, Janan? You want to give us a little bit of a context, please?
Absolutely. So I would like to really use this opportunity to further set the stage for today's discussion, similar to a way to ground us in this space. It's really important for us to provide a bit of context around the tone and the climate of the world when we developed our Better Together strategic process as an organization. And as leaders in this audience, as well as members of the behavioral care workforce, we know more than anybody that context matters. So when we think about the ways in which we have all experienced, witnessed, and lived through time since 2020, including the COVID-19 pandemic that is ongoing, the related economic crisis, as well as widespread racial and social political focused protests, mass shootings, including the vicious attacks on our elders and the communities in the children in our communities, we are honestly reminded daily that we are living through collective trauma. In fact, many of us are likely sitting with unresolved collective grief that has left us devastated since March of 2020. So relatedly, it was during this time that we were all forced to witness, and many of us simply reminded that this work really points out the glaring inequities that exist for racial and ethnic minoritized communities, both in this country and abroad. And so as an organization, we knew that for one, self-care and in fact, community care was really necessary to support everyone's mental health and well-being, to curate spaces within our organization to process and to support each other, and to reflect on how current events influenced our work, our dynamics, and our reach, pun intended. I'll pass it off to Ingrid now.
Yes, thank you so much, Janan. And in the wake of all of this kind of unrest and, as you said, collective trauma, we knew that we kind of needed to start with something that we all shared. So there were foundational principles that we could all agree upon, right? We all had a commitment to proactively advancing social justice and racial equity. We all had a commitment to making sure that culturally and linguistically appropriate behavioral health care was happening in Region 1. So this led us to really kind of the internal work that we needed to do, assisting staff with gaining an understanding of the societal issues that we were going through, tackling the courageous conversations that we needed to ensure awareness and understanding. Our internal efforts led to the development of our Better Together outreach strategy. We developed an internal working group that included training with experts in the DEI field. And we also fully developed a strategic plan that included input from staff as well as diverse stakeholders to really guide our intentional efforts to expand our racial equity lens.
Thank you, Ingrid. And I think what was really important about this one is we really embraced cultural humility. Every person in the team had agreed to do internal work. In fact, our own Suganya came to one of our groups and the first session to introduce. So next slide, please, Ingrid, the cultural humility. Okay, so we look at internal, and that was the document that we used, developed by our amazing colleagues at the Mental Health TTC. And we separated the internal and the external, and we knew we needed to concentrate each of us on ourselves because we were partners that came from another, we all came from different places, as we all do, and different walks of life. So it wasn't about necessarily we are going to go someplace. We initially started really to think about this is a journey, and we took appreciative inquiry stance, which means we are always discovering, learning, asking questions, and being open to potential opportunities. That led us, for the next slide, this one, I'm sorry, to have courageous conversations. We needed to start our own courageous conversation where we really were able to see, and we developed some compassionate practices that I think Ingrid will share with all of you. We'd love to get your feedback on that document as well. So this kind of internal work developed simultaneously with the external work and the intentional outreach. As we build our plan, we clearly had to build an equity plan, very different from the goals. And in every single project and in every single goal of the New England Mental Health TTC and the school Mental Health TTC, we had intentional efforts to achieve diversity and equity goals. I think it's time for a poll.
Right.
I'll launch that.
Oh, thank you.
Oh,
You can see me thinking, right, Janan?
it says I cannot. I got an error, but maybe.
Oh, I see it.
Should be launched already.
Oh,
it's
okay.
launched.
And amazingly, it looks like 100% right now. Can you see the results, Janan, as well?
I can see the results. I can
good.
see, yep, I think we're halfway there. So for those who are kind of participating in the poll, I'm happy to read the question aloud just to get some more participation. In the wake of COVID-19 pandemic and the ongoing racial and socio-political unrest, did your organization create spaces and opportunities for you to process what was going on in our world and how it might impact work dynamics? I think we're waiting for a few more participants. We're very close.
Yeah, if you let me know when you want me to close, I can close it, and then the results will be available for all to see. Yeah, 15 out of 20 who have participated thus far.
I think that would include everyone minus the panelists. So I think that is everyone. We can close it.
There you go. I've just shared the results with everyone.
Awesome. So I'm encouraged to see that many of you, the majority of you, are part of organizations that did acknowledge what was going on in terms of a current events perspectives, but also created space for members of your organization to really reflect on what was going on and how it was impacting both personally and professionally. Thank you for participating in our poll. And yes, I also acknowledge the question in the chat. And as Maria said, we hope to acknowledge that throughout the presentation.
So here's kind of a look at our strategic process, just going quickly through the various points. We knew that we needed kind of an opportunity to gather and distill the needs and perspectives of a larger, more diverse audience in our New England region area. We wanted to then incorporate that feedback to develop and deliver training and technical assistance activities that were really based on that needs assessment and that input, that lived experience, focusing on delivering that universal training and technical assistance, developing information and education campaigns, and then of course, always implementing, managing, and measuring results. And that's something that we wanted to do throughout. And so Maria will talk to you a little bit more about what we prioritized as a result of that needs assessment work.
Thank you, Ingrid. And Jasmine, a fabulous question. So how did we got to set up the stage for those conversations? I think, first of all, we all agree clearly, as Janan explained, the events that were carrying on in the country, but each of us also had to really engage in a conversation as to why we as a mental health TTC wanted to do this work. And once we established that, and that's what the Courageous Conversations was so powerful and important, because we all kind of had an agreement that we were going to be do this journey, and then we will bring various speakers depending on the needs of the region, right? And we're still kind of going through that process as well. So what we did then, in order to make priorities, so this was all kind of pieces going simultaneously, the internal work and the external work with all those directories and intentionally doing outreach. There were three things. We were very intentional about the outreach. We wanted to know what was on the area in our region, what populations we were not reaching out, and that's what the directory came. We Ingrid built a directory of all the BIPOC communities in the region. We amplify clearly the voice of perspectives of people with lived experience. That's something we do in everything we do. And then we create opportunities not only for us, but also for the community in different ways. And that's what's going to become, eventually, we found that was the reach. So the overall initiative is called Better Together, because we're all together doing this work. But then after that, we started to do a little bit more of intense TA, which we will describe in just one second. So those were the intentional outreaches and objectives that we added to our plan. So I'm going to turn it over to my team colleagues from my partners so they can tell you a little bit about what were those specific. Did you create an instrument? That's a great question. Yes, we do have an instrument that we'll share. Ingrid will talk about that, but we will share everything, and we love to know if you have even better instruments, okay? Because I know there's a lot of things out there. So the next slide, I'm just going to tell you, just to give you an example, how we move from theory to practice and make it very concrete. What we did is slide 21 first, Ingrid. And next slide, thank you. Okay, so once we did that intentional, no, the next one, thank you. There are two, and we do activities with this at all levels. So I'm going to turn it over to my colleagues at C4, and they're going to mention an example of two very concrete initiatives that have been outreaching BIPOC communities. Livia, welcome.
Thank you so much. It's so nice to be here. Again, I'm Livia Davis. I am one of the partners on the New England MHTTC, and also I work for C4 Innovations as the Chief Learning Officer. So under the leadership of Holly Echohawk, who is the Tribal Behavior Health subject matter expert for our team, the New England MHTTC collaborated with the United Southern and Eastern Tribes to conduct the 2022 Tribal Project ECHO learning events on Indigenous mental health. And that series is titled Reclaiming Native Psychological Brilliance. It kicked off in January, and between 300 and 400 people registered to attend each month. So for a total for the first 3 months, we had 992 registrants, which included representatives from 215 tribal nations. The monthly topics range from nurturing psychological brilliance and resilience in Native youth, to Native self-help declining and Native help seeking, to substance use and hungry ghosts. A full schedule of the series can be found on our website. You just want to click on the banner that says Reclaiming Native Psychological Brilliance webinar series. And I think part of the reason that this series has been so successful is our commitment to center and amplify the voices of people with lived experience in both the design and the implementation of the events. And of course, the Native expert presenters, and a format that is culturally intelligent. So in the design and implementation of this series, we took a lot of what we had learned together to make sure that we led with the values and principles, and that we use the conversations we're having in order to make sure that we lead with what we believe in. Another training event that we implemented under the leadership of Dr. Ashley Stewart was with a board of directors of a state chapter of a national behavioral health organization. And they had asked for support in order to support members individually and collectively to identify commitments to equity, inclusion, and diversity, as well as actions that would make people of color and other marginalized populations feel welcome and safe and understood in terms of their needs being met as minoritized and oppressed people. So through a 6-month process, the New England MHTTC supported this board to understand the importance of starting with addressing anti-Black racism when embarking on diversity, equity, and inclusion initiatives. So often folks start with diversity, move to equity, and then inclusion, and we really talk to them about starting with equity. We also work with them to really understand the symptoms of racial anxiety as it relates to having conversations around racism and racial equity, and how you can use those symptoms as a cue to develop a plan of how you're going to respond to instances of racism and oppression. We talked about the scientific racism that lays the foundation for a lot of people, for a lot of helping professions, that still permeates them today. We talked about how that history impacts the BIPOC community members in terms of accessing behavioral health, and the distrust of the helping professions that exist. We talked about how racism is experienced in the body. We talked about understanding white dominant culture and what to do about it, and how we can stop perpetuating it and really understanding it. And then this whole idea about moving from thinking and learning about what to do to actually identifying actions and committing to taking those actions was something that we then ended our engagement with them. So what does it take to transform? And then what are the commitments you're going to take based on what you learned? And how can we hold each other accountable to moving forward? And then lastly, I want to mention that the announcement just came out from the African American Behavioral Health Center of Excellence that has announced a learning collective opportunity on organizational wellness and change, which is around addressing institutional bias to achieve organizational equity. And that is something we are supporting, and it runs from July 14th through August 18th. And I'm going to turn it over to my colleague, Vanessa.
Thank you, Livia. Yes, hi, everyone. So I wanted to present some of the work that we've been doing in this realm, specifically with collegiate mental health. So our region is home to more than 250 colleges serving more than 800,000 undergraduate students. And a sizable and growing number of these students have significant mental health needs. And students identifying as BIPOC and first generation are more likely to experience depression and anxiety than other students. They're also less likely to access treatment and support services when they need them, and they're more likely to attend community colleges. So what we decided was that community college students, they juggle competing work and family demands, as many as half of them experiencing mental health conditions. And as we know, at the same time, community colleges often have fewer resources to support student mental health than four-year institutions. So as students and faculty and staff across the region, we've grappled with these unprecedented stressors and demands related to the pandemic, meeting the challenge of supporting students most in need on campuses with the most limited resources is most critical than ever before. So what we decided was we established a work group, and we invited national experts as well as campus mental health leaders from around the New England region to discuss the challenges, share promising practices, and identify the opportunities to improve services and support for BIPOC students. And we, since our third year of the grant, we've hosted 3 convenings, and the first convening was in February of 2021, and we also had a convening on May 6th of 2021, as well as January 13th of this year, where we were able to connect with the stakeholders around the region to discuss what is needed and how we can help. And I'll pass it back to Maria and Ingrid. Thank you.
Thank you so much, Vanessa and Livia. So as you can see, these were just very intentional efforts that went on the plan that were not originally, initially we were thinking about it. I would like to know, I know Raquel, you're on the line as well, and we didn't have a time to connect, but our other partner, the Harvard Department of Psychiatry, they lead the Early Psychosis Initiatives. They also themselves were very intentionally in terms of providing a lot of care around cultural competence, cultural competent care, and equity issues. Raquel, I know I don't want to put you on the spot. If you want to introduce yourself, we can. Oh, there we go. Thank you.
Sure. I'm happy to just briefly say a few words. So Raquel Meshalem-Gately, I am the Harvard site co-director for the New England MHTTC. And as Maria was mentioning, over the past couple of years, we've been implementing an online series for clinicians to provide culturally responsive care and address cross-cultural barriers in early psychosis. The series explores the unique cultural impact towards an individual's openness to care, perceptions of care, treatment adherence, which includes acceptable treatment and treatment duration. And we've really tried to include a series of experts who are actively engaged in thinking about how clinicians can increase awareness of systemic factors while also developing deeper connections with their patients. And what I can do is put a link to our online series in the chat. We've had about 9 sessions so far, and we're planning some more in the upcoming year, including a series of 3 to 4 sessions, which will be a collaboration with the Hispanic Latino MHTTC to specifically work with Hispanic Latino clients who are experiencing early psychosis. That's, I think,
Thank you so much, Raquel. Yes, please make sure you, it's fabulous. And I think lastly, we do have from the beginning a very robust Latino initiative. Thanks to Brazil Reese, who is here in this call too, we are now also reaching the Portuguese speaking communities in the region. We have since the beginning partnered with the New England, with the Region 2 Mental Health TTC, the Caribbean, and also the Hispanic Latino, and have developed all around recovery, have developed fabulous tools for people to look and understand what recovery is in both English, Spanish, and Portuguese. So our efforts continue, and we make sure that we are representative, including in our board member. We really try to make sure, in addition to people with lived experience, people from all walks of life that are representing New England. Clearly, this is work in progress, so we have ways to go. So we had planned to do a breakout session, but we feel like given the time, we want to just perhaps, Janan, I'm going to turn it over to you, perhaps understand a little bit. I think is the tool that Suganya is asking for too in there, because we want to make sure we don't get talking to each other as a team. Perhaps you can lead the question. And just so you know, this is how we do our sessions. Every single session is very interactive. As Ingrid pointed out, we start with music, we do workout rooms. We really try, because we understand this work is really about connecting with each other. So
you'll have access to this document, and you'll be able to kind of review and hopefully circulate it amongst your organization. But I really think the importance of a document such as this is to assess the readiness of your organization to dive into this work. This is also led with the spirit of intentionality, to ensure that you have the leadership, whether that be leadership within your organization, but also institutional leadership, to really support this work so that communities and folks are not further harmed when we're doing EDI work, especially when we're thinking about the communities that we're serving from a behavioral health perspective. So there are a few questions that you can kind of reflect on and kind of discuss among your organizations. I know Ingrid's scrolling through those now, so it might be, feel free to take out your phones and take a picture, but you will have access to this so that you can really intentionally use this tool to assess your organization's readiness to dive in. And I think this also creates a moment of reflection to think, if you don't have some of the answers to these questions, how do you get the resources necessary so that you can move forward? So not only does it assess your readiness, but it might point out some of our unintentional blind spots so that we know what type of resources we need to collect moving forward.
thank you, Janan. So we wanted to now move a little bit more into our reach work and what exactly that means as we think about the different levels of TA that we are all working on. If you think about then the internal and the external work that we've been doing parallel to each other, then what we do know is that we really need to respond at a multiple levels. So of course we have the, the universal, we all know this, I'm not gonna tell you about that. So, and how we do real change. And again, as I said, we are all about equity lens to embrace recovery. What we really want at the end of the day is respect individuals and family lives and find meaning and purpose in all we do. So Ingrid, please, next one. I'm gonna start coughing now.
Do you want me to help out here?
Yeah, please.
So racial equity and advancing cultural humility for organizational change learning community is really an opportunity to hear from experts in the field, to access evidence-based materials, and to learn how to develop and really to put in place an action plan to shift policies. It's really important that this work for us is grounded in our principles of recovery, and the learning community is designed to support the entire workforce supporting behavioral health needs in New England.
And I want to add that it was Ingrid who came up with this name. So the REACH work, the REACH is the one that we use for our learning community efforts, like a more intense TA. So, and the whole development of it.
So through our sessions, participants can access high quality training, but also gets feedback and access to subject matter experts. It creates an opportunity to build community and really create equitable partnerships. In year 5, we started our BIPOC mental health resource directory. We have about nearly 600 mental health organizations or BIPOC organizations initiatives in the database, but we really wanted to do more engagement with SAMHSA Centers of Excellence in year 5, create opportunities for agencies and organizations to apply for a listing in our online resource, and also to develop a self-paced online course to offer evidence-based, but also practical resources to help participants break down barriers and build up support mechanisms for long-term anti-racist work, right? This work, you're not gonna wake up tomorrow and this is over and you're anti-racist and that's it. This work is really about the journey.
And I think with the journey, I'm thinking it would be great to show them the sample, the different things we're doing. One of the things that I may ask Janan to talk a little bit about is, because we know that this goes beyond the theory, do presenting, we find speakers or we present, we have, depending on what the needs are, but we also accompany any kind of webinar with diversity talk, we call it. It's a hands-on debriefing session following a week after the training. So that way people have an opportunity to, okay, I hear these concepts because we know how that works. It's all theory, but how we move from this to that. So we have being successful in kind of that model. Some sessions, land better to that, but I don't know, Janan, if you want to add to the diversity talks concept.
Sure. So similar to what Maria just mentioned, I think a lot of times when we think about EDI work, sometimes it feels a little top heavy and theory driven. And so we question, how do we put this in practice? How do we actually deliver some of these programming or skills that we're trying to implement in the workspace? And so our diversity talks really offer an opportunity to be very interactive with our group, as well as the guest speaker for that month, to think about, okay, you've given me this idea, how do I translate that into action? How do I bring that back to my organization to offer that as a skill set, a tool, an idea, a concept that we can really put in motion? And so not only does it offer a time to be more interactive and conversational in this work, but it also creates moments to curate communities across the New England area so that we have different social justice warriors, so to speak, or stakeholders that we're engaging with. So I really think it's important to have that kind of two-tier approach or two-pronged approach to EDI work. Is one, let's educate, but then let's also think about how do we put that into motion and practice so that we really can have the intended outcome that we want, especially when we're thinking about promoting marginalized communities.
And then in terms of the products we developed for year 4, we really concentrated on content development. Year 5 will really be about product dissemination, as well as a bit of content development as well. But in year 4, we created a number of assessment tools, various action plan templates, evidence-based training materials and videos, of course, and then fact sheets like the one we shared here, infographics, and even continuous improvement plans, again, because this is something that needs to be measured and continually tweaked as you continue this work. We, as I shared, offered a number of different needs assessment opportunities. Some of those took the form of listening sessions where we gathered stakeholders virtually to really listen more than we talk around what they needed in terms of the supports that we could offer from the New England MHTTC. We're also continuing a real concrete step with SAMHSA, the Region 1 office, and their work around the Diversity and Inclusion Project Showcase. This is an opportunity to help smaller, particularly marginalized community-based organizations that might not be in kind of the funding pools for funders and federal grantors. So this is an opportunity to help give them a little bit of shine, to work with them as a collaborative effort around their nonprofit strategies, even everything from how they manage to how they carry out their vision and work in their communities. And this is an opportunity, again, for us to build community, but also to help to bring funding to some of these efforts that are going on in local communities.
Thank you so much. So yes, of course, Todd, we will distribute the slides, absolutely, and any resources you may want to, this is for everybody to share. So what have we learned? And again, I want to get a sense of whether or not we should do a breakout session after this, just briefly, or we should just stay as a larger group. I guess the hour is really flying here. Janan, is there a takeaway that you can say in terms of how we are learning and how we want to learn every day and improve?
Absolutely. So I think in regard to our work around EDI, there are two other concepts that I would just like to center in this conversation. The first being justice. And so really making sure that we are understanding the importance of racial justice, that we are trying to put practices and plans in place to secure justice for marginalized populations, that we're not just inviting folks into spaces in the efforts of diversity that can be quite violent, actually, if you invite people in spaces that you're not really thinking about how some of the work is affecting them, which could be harmful. So that's one concept that I wanted to bring forth. The other concept is belonging. And so it's great to center equity, diversity, and inclusion, but if people don't belong in such spaces, it's really hard for them to kind of sink in, into the work or relate to the work that we're doing as an organization. I like to think of this as a party. And this is an example that I am borrowing from a social worker here based in Connecticut. But you can, when we're thinking about EDI spaces, right, we can invite people and welcome people that are a part of marginalized or minoritized communities to these spaces. However, we can't always expect that folks will feel like they belong. And so if you're inviting folks to a party, do they really feel like that they can wear their best party outfit? Do they really feel like they can show off their moves? Do they really feel welcomed in this space to be their authentic selves? And if the answer is no, then we really need to take a step back and think about our EDI work and making sure it also includes a sense of belonging. So I just wanted to kind of point that out as a moment to, one, really ask us ourselves to internally reflect and interrogate the actual practices and places that we are doing and promoting EDI work, especially as it relates to the communities we're serving.
Thank you so much, Janan. And I think if I want to add a second point, is the importance of really being inclusive and leading this with an inclusion eye. I think, and I think Jasmina, to answer your question again, I think this is all started because our own team was willing to take a look, each of us were willing to take a look of ourselves, to readings, to do all this kind of work together. And we all kind of were feeling respected. I think the importance of feeling valued, respected, is so essential for this kind of work, because I think the only way to lead these efforts is we are all feeling inclusive. And I think, as Janan said, they feel like they have a voice in it. And we have been learning across. It hasn't been a smooth ride. There's lots of bumps in the road, but we are still going strong. So Ingrid, any last points in terms of our lessons?
Well, again, we know that the importance of assessing your agency or organization's readiness and planning for success is key. So we definitely want to make sure that that's a takeaway. And as Maria has just shared, inclusive leadership is critical to DEI efforts in the workplace, but generally. Then, of course, the importance of making sure that you have stakeholder outreach and engagement, input and buy-in that must be integrated into all of your DEI strategies.
And Ingrid, you may want to advance this slide because we were talking and we didn't include it, but you can see kind of some lessons learned. And of course, we'd love to hear your thoughts on all of this. So I think I think lastly, what I would like to do is really talk about self-care and community care. None of this, especially what we had to face in terms of pandemic, COVID, you name it, and the violence that's still to this day. Self-care has been a huge if part of this for everybody, our own team, and that actually the communities as well is so important. And I think all of the partners have done a lot of work around self-care. At that time, we all had the wellness supplement, so that actually fit very nicely. But we acknowledge the importance of self-care. And we do have some principles that I think we developed something called the Compassionate in Action Principles. And we really would love to share this with you and hear, because again, as you keep hearing us, it's about intention. It's about intention. And I know there's tons of things in the field about listening, paraphrasing, responding, but we came up with this. It's a mix of things from many different sources, but we love your input and time to reflect and see what you think. But we always start with this, inviting people on the space and kind of take this, this kind of come with this in mind. We're not here to fix anybody, to blame anybody or anything like that, but just Ingrid, I don't know if you want to add anything on the you want to just show it for a little while.
Can you see my screen? Yes.
Yes.
So, right, I think that the important part is, you have to work at these things, right? So you have to cultivate compassion. You want to find ways to connect with the feelings of others and allow that to guide the atmosphere such that there's respect and understanding. You want to listen with the heart. I always tell people that, sometimes you have to quiet your own mind to listen to someone else, stay grounded in your body and create a space to manage because there will be tension created by the multiplicity of views and feelings that are going on. And then of course, listen openly, seek out information, have appreciative inquiry for others and their lived experience, and expand your mind. Listen honestly requires an openness that accepts both the person and their thoughts. And so that touches on a little bit about what Janan said in terms of justice and belonging.
I would also just want to add here in regard to self-care, it's really important, and I really urge everyone here to think about the importance of rest in this work. And so I like to think of a constant dance of resisting and resting, resisting the systems of oppression and resisting kind of ways that are currently just as is, that are really harmful to certain groups, particularly racially and ethnic minoritized groups. And then also making sure you create time for rest for yourself personally. Otherwise, a lot of our works and efforts will not be sustainable. And so we have to center rest as a part of our self-care and community care plans, and do that dance however it looks for you of resisting and resting, but find that balance for yourself, because this is one of the ways that we can remain sustainable and most importantly, impactful.
And then to, suspend judgment of yourself. I always tell people, give yourself and others a break. There's such a thing as grace. In this kind of work, there will be some ouch moments, some toes will be stepped on, but let's give ourselves a little bit of grace and respect yourself and others. Stay centered, right? All of this works together because really, when you listen, that's the best gift that you can give to someone.
Thank you so much. So I think clearly we're going to be sharing this with you. And now I think we'd like to have some time for questions, thoughts. We'd love to hear your feedback, suggestions. We are learning as we move. As Ingrid indicated, we're planning our last year a little bit as well. And there's so much need. This is going to continue for many years to come. So any thoughts, questions? We'd love to for any of us in the team here today.